Hi, I'm Casey Glade, and this is my return demonstration for wound care for NR224. Knock, knock, knock. Hi, Mrs. Hernandez, it's Casey. I'm your nurse, and I'm back to assess your pain since I gave you that pain medicine about 30 minutes ago. Can you rate it on a scale from 0 to 10? Okay, sounds like it got better. Can you just tell me if you have any allergies one more time, please? Okay, great, thanks. So I'm going to do your dressing change now that your pain medicine has kicked in. So before we get started, let me just close the curtain for your privacy. I'm just going to wash my hands. Now I'm going to do this dressing change just so you don't get any infection and to promote good healing. I'm going to remove the old dressing, I'm going to irrigate, and then I'm going to put a new dressing on. If you don't have any more questions, we can get started. All right, thank you. I'm just going to raise the bed up to a good level, put some hand sanitizer on. I'm just going to have this trash bag set up here by your feet. And I'm just going to put on my protective equipment, just in case there's any splashing. I'm also going to put on my mask. My protection. Eye protection. Okay, so I'm just going to start. I'm going to remove your old dressing. Okay, I see that you have the absorbent pad underneath you, so that's good. I'm just going to remove the packing inside. Assess for color, odor, amount, and consistency. There are 3 in there. I'm just going to throw that away. I'm going to look at the wound, see if there's any signs of eschar, any tunneling. I don't appear to see any. I'm going to go ahead and I'm going to measure the wound. In the longest part, head to feet. So about 20. Look. 20 by 10. Now I'm going to do the depth. Five centimeters. So 20 by 10 by 5. just going to throw that stuff away now. I'm going to remove my gloves. I'm just going to wash my hands. Okay. So now that I've already got all my PPE on, I'm just going to put on a new pair of gloves again. Move this out of our way. I'm going to bring over our normal saline and our irrigation. Now, I'm going to put you up on your side so that we can catch any of the draining. I'm just going to unscrew the cap. Pour that in there. Okay, now I'm going to take some new gauze. I'm just going to hold it down here. I'm going to draw up some sterile water. And I'm just going to start pouring from top to bottom, side to side. I'm going to catch as it's dripping. I need to change the gauze and the water as I go. And we're going to keep doing that until it's clear. And then we're going to take some new gauze and we're going to pat it dry around the side. Make sure not to get inside of the wound. And we'll throw that away. I'm going to take off my gloves, wash my hands again. And now we'll get ready for the sterile part. Okay, let me just lay you back down. Well, I'm going to wash my hands before we get started. Open our dressing kit. We'll lay out all of our supplies. This is my sterile Q-tip, by the way. I got out of my sterile packaging. And here's another one. Okay, so first I'm going to take my sterile packaging. I'm going to dump my sterile solution in here. And then I'm going to take my gauze. I'm going to put it in that solution. I'm going to take it out one by one. I'm going to give it a good squeeze, get all that extra moisture out. I'm going to separate it. I'm going to take my sterile cotton applicator, and I'm going to slowly push it in there. Make sure to get all the edges. This third one will do it. Make sure you get to all the edges. Not to touch, only with the cotton applicator. Now that we have that packed, we're going to take our ABD pad. The blue line goes on top. We're going to take our tape. And go around each edge. Sure you get around each edge good. And then I'm going to make a label. My initials, the date, and the time. Okay, and that will do our dressing change. I'm just going to remove my gloves. And take off my gown. And just make sure that before I go, I want to make sure that your bed is in a low position. I'll clean up all of my stuff here. Okay, I'll give you your call light. Are you comfortable before I leave you? And how is your pain right now? Okay, so it's still not too bad. All right, I'm just gonna wash my hands. And I thank you very much, Mrs. Hernandez.